So these are two very simple questions. One is, was it the same patients in the second study as the first study?
There are some overlap.
And the second study is, if after an adaptation you did two studies of the same patient without exercise intervening, what kind of variability do you get in the numbers of REM to wake or N1 to N2? Or have you done that?
So the consistency of the data within the subject between the adaptation night and baseline night?
No. I give you that the adaptation is a funny night, but if you then did two different nights after an adaptation night, what kind of variability would you get within one patient?
We don't have data of consecutive nights of PSG.
Thank you for their presentation. Your studies are really interesting to me because I have CFS personally, and one of the things that's interesting is when I do too much in one day, I actually have a harder time falling asleep. So your data here about sleep latency being better and healthy controls post-exercise is interesting, because a lot of the treatment recommendations out there about if you have problems with sleep, exercise helps or activity helps, but in CFS patients, it can actually make you feel harder to sleep, and you get that wired feeling. Lenny Jason's done studies looking at fatigue, and that was one of the things that he 5 different types of fatigue that CFS patients have. And so the wired type of fatigue that's what it makes me think of with the sleep latency measure. And then the other thing that came up to me was I had tried to ask this in my email, but there was one of the studies, you split them into people who were sleepier after exercise. Like within the CFS group, there were people who were sleepier after exercise in the morning, and there's a group that wasn't sleepier. And that's also something I've noticed for myself personally. I wake up in the morning and I don't feel better as I would expect, even after sleeping 9-10 hours. So I was wondering, when you ask patient or subjects that, how do they interpret that sleepiness question? I don't actually feel sleepy, but I don't feel better. I feel, still feel bad.
So we use VAS, visual analog scale, to collect subjective symptoms, and we put the word term sleepiness, and we ask the subjects to rate their subjective sleepiness.
So it just says sleepiness with no further description,
Yes.
and they can interpret it in the way they want. Okay.
Yes.
And then my last question is, I know that some of the subjects in the studies overlapped, and so you had one group where it was sleepier versus non-sleepier, and one group was CFS and FM, and I was wondering, it's such a small sample size, it's hard to make correlations, but is there any differences you see, for example, in CFS patients versus FM patients in terms of how sleepier or more fatigued they are the next day?
Yes, we have compared the sleepiness between CFS alone versus CFS plus FM, and in terms of sleepiness, there were no significant difference. The only difference was seen in pain scale. CFS plus FM had greater score on pain than in CFS alone.
It would have been interesting if there was a way to look at FM-only patients, and
unfortunately, we couldn't find an FM alone patient.
We have 6 minutes, and I'm going to call on Martin, Cindy, and Margarita.
Kishi, I enjoy that very much. Suppose you have a normal person, a healthy person, not with CFS at all, and his usual workday is 8 hours, and he works a 12-hour day. Is there a change in the transition from REM to wakefulness? Have you studied that at all?
We haven't studied such kind of design of the study, but the effect of exercise is one thing that we could think of, and REM to wake transitions did not differ in healthy controls.
Thank you. Cindy and Margarita.
Oh, I see. I don't have my glasses on, sorry. Thank you very much, that was wonderful. I wanted to ask if you had done any sleep studies after more than one type of stressor, such as 2 exercise tests or exercise tests in 2 days in a row, or other kinds of stressors.
Yes, it would be great if we could do that. But this protocol was one of the series of protocols. So we chose study one bout of exercise and the effect of exercise on subsequent night of sleep.
And have you done more than one, or sorry, have you done a sleep study more than at a longer time period after the exercise? So you did the sleep the same night? Have you done a study that's
Yes.
maybe on the second night or
Yes.
the third night after exercise?
That's a great point, and unfortunately, we didn't study the multiple nights after exercise, but that's one thing that we would like to do that in the future study.
So we're asking you for your whole career of studies, so I feel a little bad that, you know, you're just doing your postdoc, and we wanted you to have all the answers for your next 5 years. But with that in mind, I guess my question had to do more with, are these studies really powered to test difference given the error margin of this test, was my question. Do you know if they're really powered? I guess I had a question on sample size, and had you...
So you mean the effect size?
Right, that the effect size, given the error margin, you know, in this test could be wide enough, so you need a
Yeah.
bigger sample to actually detect differences between the groups.
Oh, we didn't analyze such kind of that.
So you haven't tested whether you're powered to do this?
No.
Okay.
Quick question. This is not related to this data, but I'm not sure about what sleep cycles look like in overtrained athletes. Do you know anything about what we see in overtraining syndrome and sleep cycles? There's some suggestion that we might see some similar patterns between overtrained athletes and chronic fatigue syndrome, so that's why I'm asking.
As far as I know, I think they have difficulty to fall in sleep. That's one thing that I know.
So you have autonomic data from your exercise physiology study, and presumably you have some autonomic data from your overnight sleep study in the sense that you have RR variability, I would think. Do you have any data on the role of sympathetic drive on this symptom of fatigue or any of your findings?
I think one of our colleagues looked at the heart rate variability during sleep, and they found some difference between patients with CFS and healthy controls. They also studied the cytokine after exercise, but they didn't find difference between the groups.
Nancy asked my question. That was great.
Thank you.